I joined here today because I'm actually from from an investing background, but I used to work in impact investing. So from that perspective, I was really interested to hear from a professional working in the financial sector really creating an impact right now. I think with Corona, the field of the field at which you work can change dramatically. So could you maybe highlight or let us know on what you have been doing recently with in response to the pandemic, and then maybe touch a bit on how you think the pandemic or the response to the pandemic will change the financial industry in for the long term, maybe shifting more towards impact investing or SDGs?
I mean, I come from a financial services background. I used to run a large international bank, but having been CEO for 9 years, I then decided that I wanted to do something different and use my skills in a different way, and turn to the world of global health. COVID-19 has transformed the world of global health. It's been a massive crisis which has obviously killed tragically many millions of people, but also had a knock-on impact on other diseases. We've gone backwards on the 3 other biggest infectious diseases in the world: HIV, TB, and malaria. But has also been a stimulus for a lot of innovation and rethinking about the way we do things. The Global Fund moved very quickly when COVID first struck, and we created a new mechanism to support countries both in responding to COVID-19 itself and in mitigating its impact on other diseases. And actually, the Global Fund has been the biggest provider of support to low and middle income countries for everything other than vaccines. We did the diagnostics, the PPE, the oxygen, the treatments, the enhancements to health systems, and all that kind of thing. Turning quickly to your question about the impact on financial services. Well, for the first point I'd make is that now, at least, the world of finance is taking the risks of infectious diseases more seriously than it was prior to COVID. Actually, before I joined the Global Fund, I spent some time when I was at Harvard trying to get the world of finance more worried and more interested in this, including the IMF, and I was very unsuccessful. I do think it's important that we shift to models of investment that look not just at the immediate financial return, but at the broader socioeconomic impact, including health, including climate.
I'm taking the International Baccalaureate program in senior high school. I didn't know the number of deaths will increase from AIDS, TB, and malaria caused by COVID-19. And I'm wondering what can we do, and is there anything that can we help or support them?
The impact on HIV, TB, and malaria of COVID-19 has been pretty devastating. If you look at malaria, for example, the number of deaths we saw in 2020 had increased by 13% on what we saw in 2019, which takes us back to where we were in 2012. So we basically lost almost a decade's worth of progress in 1 year. Now, what can we do? Well, the first thing people can do is to care about it and to make sure people know that for many people in many other parts of the world, the COVID-19 pandemic is far from over, and that the earlier pandemics, because actually when we talk about HIV, TB, and malaria, we're just talking about unfinished pandemics. I mean, if you take TB, for example, in the 1950s, TB was the biggest cause of death in Japan. But Japan very successfully, effectively got rid of TB, but we haven't done that in the rest of the world. HIV was the last big pandemic to strike humanity. In most rich countries, HIV is no longer a public health threat, but we haven't finished it off in the rest of the world. And from a point of view of equity, there's a really compelling imperative for us to finish those diseases. And also because the things we need to do to finish off old pandemics are the same things we need to do to build greater protection against new threats. So strengthening disease surveillance, laboratory systems, primary healthcare, community health workers, and so on. These are all the same things. And it's really important that we have the voice of youth, that young people like you care about these things and make your concerns known so that politicians who decide how much money we commit to saving people's lives in poorer parts of the world know that they have the support of young people.
I work in the air freight cargo industry. AIDS, malaria, and HIV has been suffering people for a long time. But many Japanese people has been stranger to these things because many people think it happened in a developing country. But now the COVID-19 disaster has caused many people to suffer from the threat of infection disease and has also affected to the economy. So I want to ask you, what should we do, especially the young people, to prepare for the outbreaks like COVID-19?
To start with, I think you're right. COVID-19 has made us all much more aware of what it is like to live under the threat of a deadly infectious disease and have the disruption and the worry and the tragedy of people getting ill and losing their lives. That is the reality that's the daily reality of many communities in poorer parts of the world, not just from COVID-19, but from the earlier pandemics of HIV, TB, and malaria. But these are diseases that actually have more impact on the poorer parts of the world, the very poorest countries. You're much more likely to die of, say, malaria than you are of COVID-19. And that impact is not just about the loss of lives. If you take rural villages in Africa, malaria has a massive impact on educational attainment because children may fall ill from malaria 2-3 times a year. And each time they fall ill, they lose 2 or 3 weeks from school. It also has an impact on productivity because many of the adults, even if they're treated so that they don't die, are sick 2 or 3 times a year from malaria. So being able to get rid of malaria makes a massive difference to the social and economic development of some of these very poor communities, particularly in rural Africa and parts of the poorer parts of Asia. To your question, what can we do? I would reinforce the point that the awareness and voices of young people in the wealthier countries of the world, including Japan, is incredibly important. The reality is that to beat COVID, to beat HIV, TB, and malaria, and to beat it everywhere, so whether you live or die isn't just an accident of where you happen to be born, takes money. We have to raise money to fight the 3 diseases and to fight COVID and to make everyone safer from future infectious disease threats. And we need the support of the G7 countries, including Japan, to be able to do that. And for politicians, for political leaders in the rich countries to be able to provide that support, they have to know that the people in countries like Japan support them. And young people, I think, have a particular role here because it's your world that we are working to protect. It's your world that we are making safer from the threat of infectious diseases. So we need your voices. We need you to make clear to your political leaders that you care about what happens to somebody in a rural village in Africa, in a slum in Philippines or Bangladesh, that this isn't just about the health of the people who live in Washington or London or Tokyo, but it's about the health of everybody in the world. And that's why I'm really thrilled that you, all three of you, are so interested in this topic, and I'm delighted that you took the time to join me this early in the morning. Thank you.